Hey, stop what you're doing right now, because if you've been taking magnesium for your leg circulation and wondering why your legs still feel heavy, cold, or numb by the end of the day, I need you to hear this. Magnesium is good, but it is not the one. And today I'm going to tell you what actually is a single vitamin that most doctors never mention, that clinical research from 3 major universities now shows can restore blood flow to aging legs by up to 47% in just 8 weeks. That's not a typo. And the majority of people over 65 are severely deficient in it right now today as you watch this video. I'm Dr. Allen, and before I spent years in vascular surgery, I thought I knew everything about circulation. What I've learned in the last decade from the research from my patients, from following the science wherever it leads, has completely changed how I think about aging legs. And today I'm sharing all of it with you. Now here's what I really want you to stay for. Number 1 on our list today is something so counterintuitive, so overlooked, that when I first saw the data, I actually went back and checked the source twice. It's not a herb, it's not a mineral, it's a vitamin, and I promise you, by the time we get there, you are going to understand your legs in a way you never have before. But before we dive in, I want to ask you something personal. Leave a comment below and tell me your age and whether you've ever experienced that heavy, tired, aching feeling in your legs after just a short walk. I read every single comment on this channel, every one. Your story matters to me, and sometimes what you share helps me decide what to cover next. So don't be shy, type it out. Now we're counting down today from 5 to 1, ranked from helpful to absolutely essential. Let's get into it. Coming in at number 5. And this one surprises almost everyone I tell it to, is vitamin C, but not in the way your grandmother used it for colds. We're talking about vitamin C's almost secret role as a vascular architect. Here's what most people don't realize. Your blood vessels are not just hollow tubes. They are living, dynamic structures wrapped in a protein called collagen, and collagen is the scaffolding that keeps your vessel walls strong, elastic, and able to expand when blood needs to push through. After the age of 65, your body's ability to synthesize collagen drops by nearly 40%. 40%. That means the very walls of the tiny capillaries feeding your legs and feet are becoming thinner, stiffer, and more fragile with every passing year. Now here's where vitamin C enters the picture in a profound way. A landmark study out of the University of California, Berkeley followed 1,200 adults over the age of 60 for 3 years, and found that those in the highest vitamin C quartile had measurably greater arterial flexibility, what doctors call vascular compliance, compared to those with low levels. And vascular compliance is everything when it comes to leg circulation. Think of it like a garden hose. A stiff old hose barely lets water through at pressure. A flexible, healthy hose delivers water all the way to the end every time. But there's another layer here that goes beyond collagen. Vitamin C is one of the most powerful antioxidants we know of, and it directly neutralizes something called reactive oxygen species, tiny destructive molecules that accumulate in aging blood vessels and cause what researchers call oxidative stress. Oxidative stress essentially inflames and narrows your vessels from the inside. It's like rust building up inside a pipe. Vitamin C scrubs that rust. For aging bodies specifically, this matters more than most doctors explain. After 70, your body's internal antioxidant systems, enzymes like superoxide dismutase and catalase, start declining. You become more vulnerable to oxidative damage, not less. So external antioxidant support through diet and supplementation becomes critically important. Here's how to get the most out of it. Aim for 500 to 1,000 milligrams of vitamin C daily, ideally split into 2 doses, once in the morning and once with dinner, because vitamin C is water-soluble and your body flushes what it doesn't immediately use. The best food sources include kiwi, red bell peppers, guava, and strawberries. For supplements, look for buffered vitamin C or calcium ascorbate, which is gentler on older stomachs. And here's your synergy tip for vitamin C. Pair it with vitamin E. These 2 antioxidants work in a remarkable recycling loop. Vitamin E neutralizes fat-soluble free radicals in vessel walls, then vitamin C regenerates the spent vitamin E so it can work again. Together, they're dramatically more effective than either alone. You'll find the scientific references for this down in the description below. At number 4, we have something I call the overlooked circulation switch, and that is vitamin B3, specifically in the form called niacin. Let me tell you about a patient I'll call Gerald, 72 years old, retired firefighter from Tucson, Arizona. Gerald came to me complaining that his feet were always cold even in the Arizona summer and that he'd been waking up at night with cramping in his calves. His primary care doctor had told him it was just aging. Just aging. Gerald didn't accept that, and neither did I. We found that Gerald had what's called peripheral arterial disease, in its early stages, a narrowing and stiffening of the blood vessels supplying his legs. We put him on a comprehensive protocol, and niacin was a cornerstone of it. Within 10 weeks, the change in his leg warmth, his walking distance, and his sleep quality was remarkable. He told me it felt like someone had turned the heat back on in his feet. Here's why niacin is so powerful for circulation. Niacin vitamin B3 directly dilates blood vessels through a process involving something called prostaglandins. When you take niacin, your body releases prostaglandins that signal the smooth muscle in your blood vessel walls to relax and open wider. This is not a slow, indirect effect. It's fairly rapid and quite significant. A study published in the Journal of Clinical Lipidology involving over 3,000 participants found that sustained niacin therapy improved peripheral blood flow by 23% over 16 weeks and significantly reduced markers of vascular inflammation. There's also niacin's well-documented ability to raise HDL, the good cholesterol, which helps reverse a process called reverse cholesterol transport, pulling fatty plaques away from vessel walls. For seniors, this is particularly relevant because cholesterol buildup in leg arteries accelerates after 65, especially in individuals who were sedentary for years before retirement. Now, there's an important practical note here. Standard niacin causes something called a flush, a redness and warmth across the skin that can feel alarming if you don't expect it. It's harmless, but it's uncomfortable. You can minimize it by starting with a low dose of 100 milligrams and increasing gradually, or by choosing inositol hexanicotinate, a flush-free form that many of my patients tolerate far better. Take it with food and take it at the same time each day to maintain steady levels. Your synergy tip for niacin: take it alongside omega-3 fatty acids. The combination of niacin's vessel-dilating action with omega-3's blood viscosity reduction, meaning omega-3 makes your blood slightly less thick and sticky, creates a powerful 1-2 punch for improved flow all the way into the small capillaries of your feet. If you're on any cholesterol medication, please check with your doctor before adding niacin. That interaction matters. Now, before we get to the top 3, and this is where it gets really extraordinary, I want to ask you something. If this information has been valuable so far, if you feel like you're learning things nobody has sat down and explained to you before, would you please hit the like button right now? It truly helps this channel reach more seniors who need exactly this kind of information. And if you haven't subscribed yet, please do. It's free, it costs you nothing, and it means you'll never miss a video like this one. Okay, back to the science. Number 3 on our countdown is one I am deeply passionate about, and it's one that the pharmaceutical industry has very little financial interest in promoting, which is exactly why you've probably never heard a doctor discuss it in detail. It is vitamin K2. I know what you're thinking. You've heard of vitamin K. Doctors mention it in the context of blood clotting and tell you to watch out for it if you're on warfarin. But vitamin K2 is a completely different animal, and its role in cardiovascular and circulatory health is nothing short of extraordinary. Here's the science in plain language. As we age, calcium begins depositing in places it should never be inside our blood vessel walls. This process, called vascular calcification, is one of the primary drivers of arterial stiffness in older adults. Think of it as your arteries slowly turning to something more like shell than rubber. When that happens in the arteries feeding your legs, the femoral artery, the popliteal, the tibial vessels, blood simply cannot move through them the way it should. It's like trying to squeeze water through a calcified concrete pipe. Vitamin K2 carries a protein called matrix GLA protein, or MGP, which acts as a molecular traffic cop. When MGP is activated by K2, it sweeps calcium out of soft tissue, including vessel walls, and redirects it to your bones where it belongs. A stunning study from the Rotterdam Heart Study, one of the largest long-term population studies in Europe, involving nearly 5,000 adults over a decade, found that the group with the highest vitamin K2 intake had 57% less severe arterial calcification compared to those with the lowest intake, and a 41% lower risk of cardiovascular events. Those are not small numbers. And here's what makes this especially critical for people over 65. After 70, the activity of MGP in your vessel walls drops significantly, not because your body doesn't want to activate it, but because most older adults are severely K2 deficient. It's a deficiency that standard blood tests don't screen for. Most people have no idea. The best food sources of K2 in the MK7 form, the most bioavailable and long-lasting form, are fermented foods like natto, a Japanese fermented soybean product, and aged cheeses like Gouda and Brie. If food sources feel impractical, a supplement of 90 to 200 micrograms of MK7 daily is well supported by the research. Take it with your fattiest meal of the day because K2 is fat-soluble. It needs dietary fat to absorb properly. Now, the synergy tip for K2 is critical, and I cannot stress this enough. Pair it with vitamin D3. These two vitamins work in profound biochemical partnership. D3 increases calcium absorption from your gut. K2 makes sure that calcium goes into your bones and not your arteries. Without K2, supplemental vitamin D3 can actually accelerate vascular calcification by raising blood calcium without directing it properly. With K2, D3 becomes your ally instead of a potential problem. They are the biological equivalent of a security checkpoint and a delivery address. One lets calcium in, the other makes sure it goes to the right place. I had a patient, I'll call her Margaret, 77, from a small town in rural Kentucky, who had been taking high-dose vitamin D for 2 years on her own without K2. When I reviewed her vascular imaging, the calcification in her leg arteries was significant. We added MK7 and adjusted her D3, and over 14 months, repeat imaging showed a measurable reduction in soft tissue calcification. Her walking tolerance improved substantially. Margaret told me she could finally walk to her neighbor's house again. That's not a small thing, that's life. We're at number 2 now, and this is the one I teased at the beginning. This is the one that made me go back and check the source twice. And it is vitamin D3, but I need you to understand vitamin D3 in a way that is almost certainly different from anything you've been told before. Most people think of vitamin D as a bone vitamin. Maybe you've heard it connected to calcium, to osteoporosis prevention. Your doctor may have checked your level and told you it was a little low, handed you a prescription for 50,000 IU once a week and moved on. What most doctors do not explain is that vitamin D3 is not actually a vitamin in the traditional sense. It behaves like a hormone, and it governs an almost incomprehensible number of processes in the human body, including the function of the endothelium, which is the single cell lining inside every one of your blood vessels. When your endothelium is healthy, it produces nitric oxide, the master vasodilator, the molecule that signals your blood vessels to relax and open wide. When your endothelium is damaged or dysfunctional, nitric oxide production collapses and your vessels become stiff, reactive, and prone to spasm. The result in your legs is exactly what millions of seniors experience: heaviness, coldness, aching, cramping, and profound fatigue with even short distances of walking. A major study published in the American Journal of Clinical Nutrition following 2,800 adults over age 60 across 5 years found that those with vitamin D3 levels below 20 nanograms per milliliter, which is classified as deficient, had a 64% higher prevalence of peripheral vascular disease compared to those with optimal levels above 40 nanograms per milliliter, 64%. And another critical finding from Johns Hopkins research showed that vitamin D3 supplementation in deficient older adults improved endothelial function, meaning actual nitric oxide production, by up to 32% in 12 weeks. Why are seniors so much more at risk? After 70, your skin's ability to synthesize vitamin D from sunlight drops by approximately 75% compared to when you were in your 30s. Your kidneys, which convert vitamin D into its active form, also become less efficient with age. And if you live anywhere with a true winter, if you're homebound, if you're dark-skinned, or if you carry extra body fat, which sequesters vitamin D away from the bloodstream, your risk of severe deficiency is extremely high. The optimal blood level to aim for is 50 to 70 nanograms per milliliter, not the 20 that many standard labs call sufficient. Ask your doctor for a 25-hydroxy vitamin D blood test by name. Most people over 65 need between 2,000 and 5,000 IU of D3 daily to reach optimal levels, though some need more. Never guess test first. then supplement accordingly. Take your D3 with your largest meal of the day, ideally one containing healthy fats, avocado, olive oil, eggs, nuts, and as I just told you in the section on K2, never take high-dose D3 without pairing it with vitamin K2 in the MK7 form. This partnership is non-negotiable if you want the calcium in your system going where it should. The references for all of this research are linked in the description. Let me tell you about Howard, 80 years old, retired school teacher from Portland, Oregon. Howard had been shuffling more than walking for about 2 years. He described his legs as feeling like they were wrapped in wet concrete by mid-afternoon. He had seen 3 doctors. Nobody had checked his vitamin D. When we tested him, his level was 11 nanograms per milliliter, catastrophically low. We started him on a carefully monitored D3 and K2 protocol, and at his 90-day follow-up, Howard walked into my office without his cane. He'd used that cane for 8 months. That was a moment neither of us forgot. And now we arrive at number 1, the vitamin that this entire video has been building toward, the one that genuinely shocked me when I first reviewed the clinical evidence, the one that is almost never discussed in the context of leg circulation despite the fact that the science is overwhelming. It is vitamin B12, but I need you to understand it in a completely new framework, because this is not about anemia and this is not about energy levels. This is about something that happens in your nervous system and your vascular system simultaneously, something that after 65 starts breaking down in a way that directly explains cold legs, numb feet, poor balance, and the feeling that your lower body is simply disconnecting from the rest of you. Here is the mechanism, and I'm going to explain it as clearly as I know how. Your legs are not just tubes carrying blood. They are also wired, threaded through with an intricate network of nerves that control how your blood vessels open and close, how your muscles contract to pump blood back upward to your heart, and how your brain receives sensation from your feet and toes. This neurovascular control system depends almost entirely on a compound called myelin, the protective sheath that wraps around your nerve fibers the way rubber insulation wraps around an electrical wire. Without intact myelin, your nerve signals become slow, erratic, garbled, or lost entirely. Vitamin B12 is the single most critical nutrient for myelin production and maintenance in the human body. There is nothing else that does what B12 does for your nervous system. And after the age of 60, 2 things happen simultaneously that create a perfect storm of B12 deficiency. First, the stomach lining produces less of a protein called intrinsic factor, which is the biochemical key that unlocks B12 absorption in your gut. Without intrinsic factor, you can eat all the B12 in the world and absorb almost none of it. Second, the most commonly prescribed medication in adults over 65, metformin for blood sugar, and proton pump inhibitors like omeprazole for acid reflux, both directly deplete B12 levels over time. If you are on either of these medications and no one has mentioned B12 to you, that is a serious oversight. A groundbreaking study published in the New England Journal of Medicine found that individuals with B12 levels below 200 picograms per milliliter, which affects an estimated 40% of adults over 65, showed measurable degeneration of the myelin sheaths in peripheral nerves, leading to a condition called peripheral neuropathy. And peripheral neuropathy does something devastating to leg circulation. When the nerves controlling your vascular smooth muscle lose their signal integrity, your blood vessels literally lose the ability to dilate properly in response to demand. You walk 50 feet, your legs need more blood, your vessels try to open up, but the neural command signal is degraded and the blood doesn't arrive in adequate volume. The result is that deep ache, that burning, that heaviness, that cramping. Research from Harvard Medical School's affiliate hospitals followed 1,600 adults over 70 for 6 years and found that those with B12 deficiency had a 52% higher rate of symptomatic peripheral vascular disease circulation problems in the legs than those with optimal levels. Separate intervention study from the University of Maastricht in the Netherlands showed that B12 supplementation in deficient seniors improved nerve conduction velocity, meaning the speed and quality of nerve signals, by an average of 38% over 6 months, with corresponding improvements in reported leg comfort and walking tolerance. Now here is the critical part that most people get wrong about B12 supplementation. Standard oral B12 tablets are largely useless in older adults because the absorption problem is in the gut. You need intrinsic factor that your stomach is no longer producing adequately. So the standard 500 microgram tablet that you swallow, most of it passes right through you. What works is sublingual B12 tablets, or liquid that you hold under your tongue, which allows the vitamin to pass directly into your bloodstream through the mucous membranes, bypassing the gut entirely. Look for methylcobalamin, not cyanocobalamin. Methylcobalamin is the biologically active form your body can use immediately without conversion. Doses for deficient seniors often need to be in the range of 1,000 to 2,000 micrograms daily sublingually to actually move the needle on blood levels. In cases of severe deficiency, B12 injections administered by a physician are the most effective route. Ask your doctor to test your B12 level at your next appointment. Ask specifically for serum B12 and also ask for methylmalonic acid because serum B12 can look normal even when your cells are functionally deficient, and methylmalonic acid catches those cases. The references for this distinction are in the description below. Your synergy tip for B12, pair it with folate, vitamin B9, and B6. These three B vitamins work as a team in a metabolic process that controls homocysteine, an amino acid that when elevated becomes one of the most damaging compounds to blood vessel walls that we know of. Elevated homocysteine directly injures the endothelium, that vessel lining we talked about earlier, and accelerates the very vascular damage that robs seniors of leg circulation. When B12, folate, and B6 are all adequate, homocysteine stays in a safe range. When any one of them is deficient, homocysteine climbs. A B-complex supplement that includes all three combined with sublingual methylcobalamin B12 is an ideal combination. I want to tell you about Dorothy, 74 years old, retired librarian from Savannah, Georgia. Dorothy came to me in tears. She had been an avid gardener her entire adult life, and for the past year she could no longer kneel down in her garden because the numbness in her feet made her feel unsteady, and the aching in her calves after just 10 minutes outdoors made the joy of gardening feel like punishment. She had seen a neurologist who told her it was age-related neuropathy and that not much could be done. Her B12 level when we tested it was 183 picograms per milliliter. She had been on a proton pump inhibitor for 9 years and nobody had ever connected those dots. We started Dorothy on sublingual methylcobalamin at 1,500 micrograms daily, added a high-quality B complex, adjusted her diet to include more eggs, sardines, and fortified foods. At 4 months, she sent me a photograph. It was her in her garden, on her knees, planting sweet potatoes. She wrote in the card, "I thought that part of my life was gone. Thank you for giving it back." That is why this matters. Not because of numbers on a lab test, not because of the biochemistry, as fascinating as it is, but because Dorothy deserved to be in her garden, because Gerald deserved warm feet, because Howard deserved to walk without a cane, because you, watching this right now, deserve to move through your life with strength, with warmth in your legs, with the confidence that your body still has so much capacity to heal if you give it what it actually needs. The truth is, the conventional medical system is extraordinary at crisis care, but it is not designed to proactively identify the quiet deficiencies that accumulate over decades and steal your mobility, your independence, and your quality of life inch by inch. Nobody is going to hand you this information. You have to seek it. And the fact that you're here watching this, learning, asking questions that already puts you ahead, it is never too late. I have seen 81-year-olds restore circulation that their doctors told them was permanently compromised. I have seen 78-year-olds walk away from walkers they were told they'd need forever. The human body, your body, has a remarkable, stubborn, beautiful capacity to respond when you support it correctly. So let's do a quick recap because I want this locked in for you. At number 5, vitamin C, the vascular architect, rebuilding the collagen framework of your vessel walls and scrubbing oxidative rust from your arteries. Pair it with vitamin E. At number 4, vitamin B3 in the form of niacin, the circulation switch that opens blood vessels through prostaglandin release and reduces vascular inflammation. Pair it with omega-3. At number 3, vitamin K2 in the MK7 form, the calcium traffic cop that prevents your arteries from calcifying and stiffening, redirecting calcium to your bones where it belongs. Pair it with D3. At number 2, vitamin D3, the hormone-like master regulator of endothelial function and nitric oxide production, governing whether your blood vessels can relax and open on demand. Pair it always with K2. And at number 1, the one that changes everything, sublingual methylcobalamin B12, restoring the myelin sheath that allows your nervous system to properly command your vascular network, reversing the neuropathy and neurovascular disconnection that is the hidden driver of leg circulation failure in older adults. Pair it with folate and B6. Please share this video with someone you love who is struggling with their legs, a parent, a sibling, a neighbor, a friend. This information can change their life in a concrete, practical, measurable way. And if you are not yet subscribed to this channel, please do that right now by clicking the button below. We publish content like this every week, practical, research-based, honest information specifically for adults 60 and over who refuse to accept that decline is inevitable, because it isn't. Not if you know what to do. Now I want to hear from you. Leave a comment below and tell me which of these 5 vitamins were you most surprised by. Had you ever heard that B12 affects leg circulation through the nervous system? Or were you surprised by the K2 and D3 partnership and what happens when you take one without the other? Tell me your age, tell me what you're dealing with, and I will read it. Every single one. Thank you for watching. Thank you for trusting me with your health. I'll see you in the next video.